Good evening, everybody, and welcome to the informational session for Acupuncture on the Hill. I'm Dr. Callie Guymond. I am a 25-year federal lobbyist. I also have been a licensed acupuncturist since 2014, and I am recently just, unfortunately, not able to be in the treatment space for a variety of personal reasons, but I have made it my mission to, after the 2020 guidelines came out that did cover acupuncture for chronic low back pain through CMS for Medicare reimbursement. We knew that we had to work very, very quickly to be named inside of the Social Security Act. And so that's what HR 4803 does. And it is the cornerstone for everything else that we need to do. If we are not defined inside of this act, acupuncture will continue to be covered. It simply won't be covered for acupuncturists to do so. And so we can always answer any questions later, but tonight is purely about the mechanics of acupuncture on the Hill. Just for the record, we've done acupuncture on the Hill quite a few times over the last few years, and we've done it differently every single time. I am fortunate enough to say that I have found the most amazing, I didn't find her, she was my supervisor when I was in school, working at Penn North and dealing with vulnerable populations that were court ordered to be there and receive acupuncture in lieu of other legal proceedings that they would have to go through for drug offenses at the time. Rhonda, if I could get you to introduce yourself, that would be wonderful.
Sure, I'm happy to. I am Rhonda Sapp, and if you went through MUH/Thai Sophia/TAI, and you went through any of the community health initiatives, you work with me probably, because I've been there since 1999 all the way through until 2022, and it's been wonderful. I was one of the people who was fortunate enough to go to acupuncture on the Hill, and it mimicked some other experiences I had where I went to different events and I offered the ear treatment, plain and simple, and then I had other people from other types of acupuncture say, "Oh, can I come with you?" And I work with them, they were my friends, and I said, "Yeah, sure, I think it'll be great to have two people." And they tried to do special things here and there, make it all, but the most powerful treatments all just came from the most simple treatment. So it was a really wonderful reminder, that we have what we need, and sometimes the first treatment we learn is the one that is the most important.
That's right. And I think I will also say this. Every single time I have done acupuncture on the Hill, 90% of the people who come through have not had acupuncture before. And this was the first time that we had been able to go back since the pandemic. So once again, we had a vast majority of people who had never, ever had an acupuncture treatment. And so our goal, because in this room, it is an acupuncture demonstration, you cannot create a patient relationship. Because according to all of your state laws, you can't abandon that patient relationship. So there are some interesting caveats to being in this room. It's not for everybody, just so we're clear, but it is one of the most effective ways to pass legislation. Most people have heard of acupuncture at this point, but they are beholden to whatever views they have of it, depending on their source. And so what we have tried to do is create very simple protocols so that we can deliver very safe and effective acupuncture on the day of usually our fly-ins. And once we do that, then it's easier for them to go back and determine that they want to sign on to our legislation. So we're going to try and do this quarterly. Actually, my goal is to do it monthly. And we want to train everybody, not just for federal work, but to make sure that we can lend support to them on their various Capitol Hill days and lobby days as well. So with that, I'm going to go ahead and get started. Just so we're clear, I'm not sure if anybody can see the whole picture.
Mhm.
This was the end of the day for Acupuncture on the Hill. And so we don't have all the practitioners in the picture, and I do hate that. I wish we'd gotten a group picture. But we were very busy that day. It was markup. And originally I had everybody registering for their appointments, but markup is a process whereby they skip committee processes and they strip language straight from various bills and they vote for them right on the House floor. So we were lucky enough to be able to pivot very quickly because of the teams that I had in place. They were amazing. And we told people just show up, and show up they did. And they often brought their own offices back several times that day. So without further ado, let's get started. All right. So qualifications are simple. You have to be a dues-paying member of any state or national advocacy organization. I don't care who it is. It's important that we are trying to build our communities, and some of the best ways to do that and be active is to make sure that you are a dues-paying member of the state association that you belong to. I don't care about the affiliation. It can be any state organization that you are a part of, or really any organization that plays a role in advocacy of acupuncture that you are a part of. You must hold an active and clear license in your state. You do not have to be a DC licensee. Lots of people are confused by that. It is a federal building, and just like any federal building in any place in the United States, it is governed by whatever your scope of practice is in your state that you are licensed in. And so we trust our state statutes, and we know that it's going to meet all the other requirements that we would be looking for in terms of educational requirements, safety precautions that you would have learned, and anything else, clean needle technique, those types of things that are going to ensure that we have that we're demonstrating acupuncture in a very safe and effective way. You need to have been in practice for 5 years. It's not that I don't think that there's talent in this field if you haven't been in practice in 5 years, but it is something that the federal coordinators that I'm working with think is important, and therefore that is our bare minimum, that you have to be in practice for 5 years, and you need to currently be in practice. You do need to carry your own malpractice insurance, and you will need to provide that along with a copy of your license. And then you must be willing to travel to DC and find your own accommodations. AcuCongress does not make a dime. We train people for free, and therefore we can only do what we can do. So if it's easy for you to get there and you want to be a part of this, and you've been fully trained, and you've met all the requirements and qualifications, then we do have an interview process, because this is a very important team exercise. You get through all of that, and then we're happy to have you in that room. And then finally, and this is not debatable, I know people have different ideas about vaccinations in this field, but on Capitol Hill, you cannot treat anyone on the Hill unless you are fully vaccinated, and you must be willing to wear a mask and any other PPE that is required. And those change on a regular basis, depending on what the office of the Surgeon General or the office of the presiding physician is. So there is a note here, and it says that practitioners who meet all the requirements may apply for the interview process during the training. I cannot stress this enough. You have to be willing and able to work with this team. There are treatment protocols that we will not negotiate on. So I know people are amazing practitioners in their own right, but right now this is called a demonstration. And every single time I have had somebody blow through my safety protocols, there has been a potential problem. So the only person who gets in trouble on this is me And if I come across as pretty direct or rude in the ethical requirements, I actually will not apologize for that, because I have been on the Hill for decades and I haven't been banned from the Hill yet, and I don't intend to do it through acupuncture demonstrations. So, and then the last thing that you need to know is we do have a limited number of practitioners. We are seeking 2 rooms this time instead of just 1. We don't know which rooms we're going to get, and we typically won't know until 2 weeks out. Capitol Hill moves at a pace that nobody else has ever seen or mimicked. It's very hard to get in if you're carrying a lot of stuff, and it's also very hard to know exactly what that room's going to look like until the very end. But we will keep everybody posted. As long as you're trained, you have the possibility of being in that room anytime. Our goal is to rotate practitioners for each of our events, and so we encourage people to be trained. And for those who are seeing this or hearing this, please reach out to any practitioners who have already been in the field for 5 years, but also students, because we've got roles for them to play as well, and we want them involved as often as we can get them. All right, requirements. Sorry, I have to move. Okay, so you have to be willing to complete all the activities in this Goose Chase final push before September 1st, 2022. And I'm going to go over that, but the fact is, AcuCongress is not going to allow practitioners in the room unless they're actively engaged in base camp with their teams. Acupuncture on the Hill is just part and parcel to what we are trying to do, which is ultimately to pass this legislation. And so we do not allow practitioners to take part in this if they are not also taking part in the AcuCongress activities at that time. The second thing is you must attend all Acupuncture on the Hill training sessions. There are 3 of them. They start on Sunday, and I'll go over that more. And that doesn't mean that you have to show up to that, but you do have to at least watch the recordings. And at the end of it, there will be a quiz to make sure that that competencies are met. You have to be willing to sign all ethical waivers and liability release forms. AcuCongress is not going to be responsible for your behavior if something happens, and therefore, you know, and unless you're willing to make sure that we are covered, we can't have you in that room. And then lastly, once again, you have to be able to work as a team member and take direction. Compliance in the room is non-negotiable. Anyone who violates any ethical requirements or treatment protocols must leave the room immediately. And that actually is where my students come in, because we want people to oversee the room to make sure that nothing is being compromised from a safety perspective. This is Goose Chase. This is what we're doing. It's an app. You simply download it. There's a code. What we're engaged in is community building and unity building. And so we've got exercises that work for the practice, exercises that work inside of community building, and then we've got some exercises that have to do with activists and their actions together. I just put these up here because you can find them later. I'm not going to spend a whole lot of time. I give 3 exercises for practice building that include things like uploading pictures of you engaged in something that is unique to acupuncture education, things like tongue and pulse diagnosis, things that you learn like moxa, cupping, things that are unique to acupuncture. And then step 2 also in step 1, we do safety exercises. So if you're engaged in clean needle technique, if you're observing COVID precautions or universal precautions, we want to see selfies in that. And then we'd also like for people to upload a video of one of their patients, preferably somebody who would be affected by Medicare reimbursement, such as somebody over 65 or somebody who's on disability. And so there's plenty of people like that. And just get a 1-minute video of what acupuncture does for them. What we have found in the past is that the use of social media, Twitter specifically, when we use videos to send those to our congressional members, they're highly effective. We know that 10 will, will get some response from the office. 30 is typically going to get you somebody higher up in that office. And if we send enough of those videos, we're going to hear directly from that member. So we want to use social media as much as we possibly can, particularly the social media platform that most of our our legislators are on. Facebook is fine for people to have discussions, and AcuCongress does have a Facebook page, as do most of your legislators. However, that's not really where they engage, and that's not where we're going to engage. Finally, we do step 2, which has community building. Here, we're going to be looking at acupuncture research. We're going to ask you to reach out to ancillary healthcare providers or MDs in your community. We want to see you trying to build a referral network, because if we do get to a place where we're covered, we still have 80% of this field as solo practitioners. And so since the referral networks don't really currently exist, we've got to get out there and beat the pavement and publicly educate everyone about what we do and who we are and how we can make them feel and how we can help their patients. And then the last thing that we talk about is your pitch. We want to help you develop how you interact with congressional offices. The elevator pitch that people used to do, I say this all the time, it's no longer an elevator pitch. If it is, it's the fastest elevator you've ever seen with about 15 people who are trying to do the same thing. So we've gotten it to a place where it's almost like you have to develop your own tagline. And so we're willing to help you work with that. And we want to see uploaded videos of that moving forward. And then 3 and 4 have to do with the initial stages and the final stages of interacting with congressional offices. So again, we want you to gather your research. We want you to interact with these offices initially. We're going to give you extra points for the number of times that you do continue to reach out. And then we're going to provide Zoom calls for you, any sort of thing that is going to get you engaged with these offices during district week or leading up to co-sponsorship. And that's the goal. Right. And so if you can do that, just so you know, all of these exercises, with the exception of going out and building a referral network, they don't take very long. Most of you have patients that are super excited about talking about what acupuncture does for them. And the rest of it is pretty much just the one thing I know most people can do, and that's take pictures or videos of themselves and load them up. So as a double amputee, it is not lost on me that I needed to create something whereby I could do a little more sitting than I did in July. And we're trying to do the same thing for you guys. All right, so the training is open to everyone. And you can apply to participate with Acupuncture on the Hill, but the training is required regardless. So we highly encourage people to go ahead and either take part in these trainings or to make sure that they watch these videos if they want to do anything with Acupuncture on the Hill. The training includes treatment protocols, rules of engagement, safety protocols, federal ethical and legal guidelines, team building, and then day of service guidelines, which I'm sure Rhonda can tell you that is extreme. It depends on what building we're in, what the security protocols are at the time. Currently on the Hill, you have to have a legislative office actually escort you in. So Rhonda can tell you that was quite fun this time around. It really threw me for a loop, but I think that we managed it over the course of the day, and I'm glad that we have had that experience, because at least now we know how to prepare for that coming down the pike. Training schedule. We start this Sunday, August 14th. I'm going to go over federal guidelines, and I'm going to give Rhonda and Jen some time to really work out their treatment protocols. Both of these women have done extensive group work and have an understanding of how these rooms work well together. And so I'm looking forward to seeing, I mean, I still consider myself a baby acupuncturist, but I am one hell of a lobbyist. So
You're the
I
best.
think between all of us, the best thing that I can do is find people who complement what I'm trying to do. And I really could not have found two better people for that. So by the 21st, they will be going over their treatment protocols. We'll have those in a manual, and we'll all be working together to make sure that we give you things that you can tangibly put your hands on as we're training you. And then the last one is going to be team building and day of service guidelines. I'm going to try and keep all of these trainings in about an hour. The only one that might be different is going to be the treatment protocols. And Rhonda, you and Jen can decide how long you're going to need on that. And that might be a series of videos that then we can pass on to other people. Either way, we'll figure it out. Those are the 3 days that we have. And so we'd like for people to commit to them in person if they could. And if not, make sure that they can watch the videos so that they can take that competency quiz afterwards. And we'll schedule interviews during that time as well. We're going to announce our teams on Monday, August 29th. We'll base those decisions on all who've completed the training sessions and taken the competency exam and have had their interviews with, it will be me and Dr. Blake Langley and Rhonda Sapp and Dr. Jim Broadwell, or some combination thereof. It is important that people can easily travel to DC. It won't always be important because our goal is to take this to a larger event where we're performing these in state capitals on the same day that we're performing acupuncture on the Hill federally. So if you don't get into the room that one day, it's really okay. Trust me, there's going to be plenty of opportunities moving forward. Safety and ethics come first. There are no business cards in this setup, no exceptions. You cannot create a patient relationship with them. And if you do, you'll be asked to leave. There is no discount that you can offer. You can't offer any federal congressional staff member anything that the public would not get. It's unethical. And so we don't allow that to happen. You don't give them gifts. You don't need to send them thank you cards. This is an acupuncture demonstration and nothing more. So I don't typically even allow people to wear name tags in that room. And the main reason is if you do anything wrong and you're wearing a name tag, suddenly you are liable at that point. Otherwise, I'm the only person who's going to be hauled into any office for ethical violations. And I'll cross that bridge when I get there. Proper protocols will be followed or you will be asked to leave. I've come close in every single one that I've held to tossing out a practitioner who is probably an excellent clinician. I have no doubt that they are great doctors, but if you can't follow safety guidelines, then you can't be in the room. If you can't follow ethical requirements, then you will never be in that room. No recording devices are allowed at any point. So there will be waivers for people who sign if because I will have a photographer there, but once inside the room, we do not allow recordings. Absolutely no posting pictures or discussion of individual treatments on social media. I don't really have to say this. Most of you are really well-versed in HIPAA, so I doubt that you would ever do anything like that, but it needs to be said. No posting of pictures, no discussion of what is going on with regards to individuals. You can talk about the process, you can talk about the experience. I'm fine with that. Just, understand that you cannot reveal details, and I don't think that you would, but again, needs to be said. Student involvement. Any of you who work at schools, please talk to your students. There's lots of ways that they can help out, be it setting up the room, holding the space in the room, guiding people back, making sure that people are following ethical guidelines, making sure that they're not engaged in treatment protocols that are not approved. making sure they're not distributing herbs because that's not approved. So we really do want as many students who want to take part. They're our future. And so anytime I can engage students, I'm happy to do so. So once again, with them, they have to be in base camp in a proper team in order to take place in acupuncture on the Hill. That's their main requirement. I would like for them to also be a current student and preferably that they're already in clinic. But I'm going to talk to my AOTH team and see what they think about that. I think federal exposure is a really, really good thing, no matter where they are in their studies, especially since we're not going to have them needle any patients or any staff members at this time. Any questions? Rhonda, I told you this is going to be the fastest presentation in history. You can all unmute yourself. You can ask questions if you want. And if you don't have any, that's fine too. I have all of the information for where to find me up. You can ping me in Basecamp. If Rhonda, I can't recall if you're in Basecamp yet, but if you're not, I'm going to put you in there with Blake and people can ping you that way. The goal is to keep people from overloading your emails and keep it all in one place. So I'm going to stop the share here because I'm pretty sure that's it. It is. And for those who are on, if you don't have any questions, and I'm not seeing anybody raise their hand, then what I can tell you is we will start training on Sunday, and I will have all the information ready and distributed for that training session. What's today? Wednesday?
Wednesday, yeah.
I have a conversation I have to have with Rhonda and Jen, and it will go out Friday night. So with that note, I think we're done here tonight, unless anybody has a question at all.
Bridget, did you have a question? I see you popped in there. Oh, nope, she's gone.
Okay. All right. Well, like I said, tonight was going to be very, very short because there's not a whole lot for people to know other than what those qualifications and requirements are. There's a whole lot of other information that will come forward through the training sessions. We have currently we have a great team that's already there. And I really, really love the idea of putting a variety of types of practitioners in these rooms because all of our licensed acupuncturists studied in such diverse ways. And I want them to be able to show off who they are and how they can make people feel. So Rhonda, do you have anything to add while we're
No, I think that's it. I mean, we all know that this simple medicine can do profound things, and
yeah.
Our confidence will show everybody exactly the message that we want to share.
I will say this, there was an experience that was in that room this last time, and we had a press secretary who had a dislocated shoulder, and his orthopedist had suggested chiropractic care and acupuncture to the orthopedist's credit. What he did was combine those two and engaged, I believe, in some dry needling, but he wasn't feeling the relief that he wanted and was getting ready to schedule a surgery. He walked out of that room with full range of motion and no pain at all. And he was blown away that he was a week away from scheduling a surgery. And now he didn't have to. That kind of activity is what is needed on the Hill. That kind of experience is the only way we're going to change hearts and minds, because the word acupuncture and knowledge of acupuncture doesn't do it. When people feel better, it makes a difference. And so to me, I'm not going to stop acupuncture on the Hill until they know exactly who we are and what we do and how we can make them feel. And it's pretty magical. So, all right, guys, with that, I didn't figure it would be an hour, and I knew once I hit 10 slides, it was going to go really quickly. And if you don't have any other questions tonight, that's fine. If you think of something I'm going to post this recording inside of Basecamp, and I will also post the PowerPoint so you'll have access to all of the contact information. I really do hope to see all of you on Sunday for the federal guidelines. It's one of the most, for me, it's the most important thing. For Rhonda and Jen, theirs is going to be the treatment protocols that you're going to need to follow and understand. So thank you. I appreciate it tonight, and I hope you all have a wonderful rest of your week.
Mhm.
Mwah. Bye, guys.